World leaders have promised everything to everyone, but they're failing. The Sustainable Development Goals literally promise everything like eradicating poverty, hunger, and disease, stopping war and climate change, ending corruption, and fixing education. This year, the world is at halftime for its promises, but nowhere near halfway. That's why Copenhagen Consensus worked with more than 100 of the world's top economists to identify the world's best solutions using benefit-cost analysis. We've identified 12 smartest solutions such as fix tuberculosis, improve education, and secure land tenure. Tackling malnutrition is one of the top 12 smartest solutions for the world. The nutrition economists find that providing micronutrients and calcium supplements for pregnant women is inexpensive but avoids millions of early and low-weight births. Each one of these children avoid a loss of 5 IQ points, making them more productive in adult life. Thus, each dollar spent delivers an astounding $24 of social benefits. Similarly, complementary feeding promotion, guiding parents to feed their children better, delivers a phenomenal $16 of social benefits for each dollar spent. This information is incredibly helpful for politicians. We promised way too much. These benefit cost analyses can guide politicians to spend better. If we can't do everything, let's do the best things first, including on nutrition.
Good evening, good afternoon, and good morning to all of you. Welcome to this webinar on micronutrients, one of the best bets for development. I think Björn Lomborg said it almost all. My name is Marty van Lieren and I'm the Director of Programs at the Micronutrient Forum. So 15 years ago, the 2008 Copenhagen Consensus already ranked micronutrient supplements as a top development priority. Out of more than 40 interventions at the time were considered. And specifically at that time, vitamin A supplementation for children and therapeutic zinc supplementation for diarrhea were mentioned. And again this year, last month, a new Copenhagen Consensus Center report highlighted micronutrient interventions. This time also for pregnant women. As Björn mentioned, MMS is one of the top 12 overall most cost-effective investments for achieving progress towards the Sustainable Development Goals. Now, in this era of accelerated, compounded crisis of a pandemic, conflict, climate change, global food insecurity is on the rise, and humanitarian development and national government resources are ultimately stretched. So investing in interventions that have the highest impact, the highest return on investment to safeguard health and nutrition of vulnerable communities is increasingly important, especially when we consider the newly published estimates of the global burden of micronutrient deficiencies, where 1 in 2 children and 2 out of 3 women worldwide are estimated to be deficient in at least 1 micronutrient. So that is the topic for today's webinar. Before I start introducing the speakers, I have just a few housekeeping rules. You will all be muted during the webinar. Please use the chat box to introduce yourselves, and you can also update your name and your organization in the little Zoom window. And then use the Q&A box to write your questions, and please indicate for which speaker you would like to respond to this question. Now, we have asked all the speakers to regularly check the questions and to respond while they can. And maybe if we have time, we will also, of course, take a couple of the questions for the live panel. And this webinar is being recorded. So now I would really like to go to the speakers. We have a very impressive list today. I will introduce them one by one very shortly. No big bios, though they will appear on screen. The first speaker that I want to introduce is John Hoddinott. John is the H.E. Babcock Professor of Food and Nutrition, Economics and Policy at Cornell University. And he is the lead author of the Copenhagen Consensus Nutrition Report. So John, I would like to give you the floor to talk and tell us a little bit more about this cost-benefit analysis that you have done. Over to you.
Thank you, Marty. It's a pleasure to be here. It's wonderful to see so many people joining us today for this webinar. Many of the people on this webinar, possibly all of you, are intimately aware of issues surrounding malnutrition in all its forms. For you, it is self-evident that resources put into reducing malnutrition are a good thing. But the world faces many challenges, not only in malnutrition, but in health, education, poverty, the environment. The list goes on and on. We have many good ideas about how to address those other challenges. So in a world with many challenges and many good ideas about how to address these, how do we distinguish between competing good ideas? And this is where the work supported by the Copenhagen Consensus Center comes in. As you saw in the opening video by Bjorn Lomborg, the center asked more than 100 economists around the world to come up with good ideas for improving a wide range of development challenges. The center then ranked, using benefit-cost ratios as their yardstick, those that they perceived to be among the best bets for development. And it turns out that some of the best investments that can be made pertain to nutrition. Working with my co-authors, Bjorn Larsson and Salima Razvi, we looked at a number of nutrition-specific and nutrition-sensitive interventions, while noting that all of them, including complementary feeding promotion, the provision of SQ-LNS, can be very powerful interventions. Today, I want to highlight the benefits of replacing iron folic acid supplementation during pregnancy with multiple micronutrient supplements. Well, why this intervention and why this focus for today's webinar? We know, as Marty observed, that micronutrient deficiencies are widespread, affecting 2 in 3 women of reproductive age worldwide. And in pregnant women in low and middle income countries, the prevalence is likely to be even higher because their poor diets do not meet the increased nutritional requirements needed to accommodate both maternal and fetal demands. Recently, however, a series of researchers around the world have conducted a series of meta-analyses. These meta-analyses show that providing MMS in place of IFA reduces stillbirths, low birth weights, preterm, and small for gestational age births in comparison to IFA supplementation alone. These are great outcomes, to be very clear. But going back to my early observation that there are many things we can do around the world to improve health and development outcomes, how do they compare to those others? Well, one of the thing we highlight in our paper is that MMS averts stillbirths, meaning that more children live and become economically productive adults. But where the big economic benefits come is through the fact that children who are born preterm or children born with low birth weights attain less schooling and develop fewer math or reading skills. As a result, they are less likely to be employed and earn higher wages in adulthood. Put simply, providing MMS makes it less likely that these adverse consequences will occur, which in turn makes it less likely that the adverse schooling and labor market outcomes occur. We estimate that the total annual economic benefits of MMS are approximately $3.1 billion. If we were to replace our current standard of care, IFA supplementation, which currently reaches 40% of all pregnant women in low and middle income countries, that is 36 million women annually, a conservative estimate suggests that costs $84 million per year. With a total benefit of $3.1 billion annually per year, that means for every dollar we spend, there's a 37 economic dollar return. Marty, I'll end by putting it to you this way. Supposing you came to me and said, John, if you invested some of my money, what would happen to it? And I said, well, Marty, if you give me $1 to invest, I'll give you a $1.50 return. You would be a really happy person. That's a 50% return on your investment. If I said to you, in fact, I can get you a $3 return, you would be positively thrilled, okay? Because for every dollar you invest, you're getting a $3 return. To put that all in perspective, replacing IFA with MMS generates a $37 return on every dollar invested. Not only is it a great investment in terms of saving children's lives, improving the lives they live, It is fantastic economics. Thank you, Marty, so much for this opportunity to speak today.
Thank you, John. And I will give you $10,000 if I have it in my bank account. So that was really amazing and very well put. I would like to go to the next speaker. We'll have a rapid pace, as you can see. And though I think she hardly needs any introduction, I will still introduce to you Mira Shekhar, who is the Global Nutrition Lead of the World Bank. Mira will talk to us about the World Bank's investment framework for nutrition. Over to you, Mira.
Thank you. Thank you very much, Marty. And thank you, John, for that very brief, but really succinct and powerful feedback from the Copenhagen Consensus. So Marty and team have asked me to talk about the investment framework for nutrition. Some of you may have seen that already, the 2017 investment framework for nutrition that we developed in partnership with the Gates Foundation and R4D. What we tried to do in that investment framework was to take the best evidence possible, the kind of evidence that John just shared with us a few minutes ago, and then put that together with what will it cost to implement these things at scale, what delivery mechanisms can be used to actually implement them at scale, and what can we buy for these investments. So we really changed the conversation from a very nutrition-centered conversation to much more of a conversation around human capital and thinking about nutrition as an investment rather than just a consumption issue, as many economists that I work with tend to think of nutrition as. And we positioned nutrition as something that will drive economic growth. Björn Lomborg, right at the beginning, talked about how many different SDG goals there are. Well, nutrition is one of those goals that, one of those investments that can impact almost all, if not all of those goals. So that is the value add of nutrition. That's the unique selling point for nutrition. We tried to do that in the 2017 investment framework, and we will continue to do that as we go forward. This framework that you have the link to in the chat, it informed a strategic dialogue all over the world. Those of you who participated in the N4G, the Nutrition for Growth Summit hosted by the government of Japan in Tokyo, saw that it became very central to that, not just in terms of advocacy, but in terms of commitments made by national governments, but also commitments made by development partners around the nutrition agenda. And we're hoping that the same thing will continue for the next N4G to be hosted by the government of France as well. Now, since 2017, when we had first developed the investment framework, which really was the very first time anyone talked about nutrition with this wider lens, we've seen, and you've just heard from John, that the evidence base for nutrition has developed. It's grown since then. And so it's time for us to update the investment framework as well. So what are we going to do? First and foremost, we've seen new interventions available for maternal nutrition, which was really lacking at that time. So we will certainly add those in. Multiple micronutrient supplements, MMS, as everyone calls it, is certainly one of those key interventions, but also interventions around small quantity lipid-based nutrient supplements, SQLNS, as we call it in our nutrition lingo. For which I want to give a big shout out to the University of California Davis team, led by Kay Dewey and Christine Stewart and many others, that is again an amazing intervention that has the potential not just to improve stunting, wasting, iron deficiency, anemia, but also child development outcomes. linking to ECD, as well as child mortality. So again, a much wider potential impact. In addition to that, in the updating of the investment framework, we hope to pull together the stronger evidence that's become available around nutrition-sensitive interventions. That includes certainly some of the gender-related interventions, as well as cash transfers, conditional or otherwise. Some of these interventions are a little bit harder to quantify, but nonetheless, I think they deserve some inclusion within the updated investment framework, and we'll do our very best. If you have evidence that we're not aware of on some of these other quote unquote softer areas, please do share those as well. So we will be updating this investment framework within the next, the work has just started, and in the next several months, you'll see many versions of this framework as it evolves. Among other things, the first framework did not include a focus on low birth weight, and it did not include a focus on obesity. That is an area that is a growing concern in the nutrition agenda, and I think it is critical that we as the nutrition community and the public health community start to focus on obesity as well. So in addition to updating the investment framework, while we were developing that, we learned that we needed a simple tool that countries could use to identify which interventions will give them what we call the maximum bang for their buck. And so we've developed something called the Optima tool, and many countries have been trained on how to use that. We will be updating the Optima tool as well with all of this evidence from the Copenhagen Consensus, as well as some of the other interventions as well. So Rijita has just put the link to the Optima nutrition tool as well in the chat box. Feel free to check it out, and we look forward to many more conversations on this. With that, thank you.
Thank you, Mira. I must say this is amazing. I'm very much looking forward to the update. Very excited that maternal nutrition is now so centered. I believe that in the 1,000 days, we have forgotten the days that are linked to the pregnancy, or at least the mother herself. So it's not only about the child outcomes, of course. And the nutrition sensitive part, I think, is really important. Also thinking about the fact that we're now looking, for instance, at anemia reduction and taking a more multi-sectoral approach to that. Thank you so much for this. I will go to the next speaker and would like to introduce to you Kim Cernak. Kim is the Managing Director of the Eleanor Crook Foundation, and ECF is well known for their Power of 4 package and the amazing work they've been doing to really drive the agenda on these interventions. Kim, very happy that you're joining us. Over to you.
Thanks so much, and hi to everyone. I'm really happy to see this group here today, and I appreciate the chance to join the discussion. In 2015, my first son was born. He was 7 weeks premature and had a low birth weight. And then 2 years later, his brother was also born. He came 10 weeks early. He was only 3.5 pounds when he was born, which is about 1,600 grams. It was the experience of becoming a mom and under these circumstances that really brought me to work on global malnutrition. My sons are now 8 and 6, and just last week I took them to their annual checkup at the pediatrician. And this is the same doctor who has cared for each of them since they were born. For other parents out there, you probably don't need me to describe the scene in the room at that doctor's visit. They were jumping around the room and they laughed at every single question that she asked them. And that means, of course, that they're strong, that they're healthy. And as their doctor said, it's hard to remember that they were born premature at all. Our story definitely started off scary, but thankfully the page has turned for us towards health, thanks in large part to our access to care for them and for myself. I also don't need to tell anyone here today that this is just not the case for millions around the world. As a mom who has gone through having children born too soon and too small, I'll tell you that I have spent a lot of my own time wishing for a magic wand. And we don't have that yet, but we do have a lot of evidence. 15 years ago now, the 2008 Lancet series on maternal and child undernutrition published its landmark series on fighting malnutrition. And I'll quote from that series. It said, "Countries with a high prevalence of undernutrition must decide which intervention should be given the highest priority and ensure their effective implementation at high coverage to achieve the greatest benefit. We have shown that the evidence for benefit from nutrition interventions is convincing. What is needed is the technical expertise and the political will to combat undernutrition in the very countries that need it most." That was 15 years ago. 10 years ago, next month, the Lancet published an update to that series, identifying cost-effective and high-impact interventions that should be prioritized to, quote, "seize the agenda for nutrition, create political momentum, and turn that momentum into results." And now, of course, in the last few years, there have been a number of additional consensus documents on high-priority, cost-effective malnutrition interventions. I think we can all agree that these successive publications should have been a wake-up call for the global community to act. And yet, over the last 15 years, there's been far too little progress that's been made in expanding coverage of these recommended interventions. Over 3 million women and children have died from malnutrition each and every year since the 2008 Lancet publication. At the Eleanor Kirk Foundation, I'm sure like many of you out there, we don't want to wait another 15 years to make sure that the life-saving power of interventions we've long known work reach the women and children who need them most. So at the foundation, our strategy is particularly focused on what we call the Power 4 interventions. And these are 4 highly cost-effective and life-saving interventions that can be delivered through health systems across pregnancy and early childhood. And those 4 interventions are, first, making sure that women have access to high-quality MMS in pregnancy. Second, that women have the support that they need to breastfeed after their baby is born. Third, ensuring that children in relevant contexts receive recommended vitamin A supplementation. And 4, that children who do become malnourished have access to treatment in the form of therapeutic foods. Johns Hopkins University found that if you scaled those 4 interventions in just 9 high-burden countries, you could reduce child mortality in those countries by up to 11%, deliver a whole host of other health benefits, and it would cost only $500 million a year. That's really powerful potential. And of course, with decades of evidence, these are not novel innovations. But what is unfortunately still very novel is any setting where coverage of these long proven and highly cost-effective interventions are delivered at scale. That clearly needs to change. Like the Lancet said 15 years ago, it'll take leadership, program adaptation, and financing to do so. I'm really glad to see MMS in particular getting increased attention by the community. As we've already heard today, and as our team likes to say, the consensus of all those consensus documents that I mentioned is that MMS really rises to the top in terms of impact and cost effectiveness. Over 20 years of evidence now shows the benefits of MMS over IFA, and that those benefits are significant, including reducing the prevalence of low birth weight, stillbirths, and infant mortality. There has been country leadership, philanthropic investment, and global policy change over that time, which have now created a groundswell of momentum to reach more women with MMS. But clearly, the job is far from done. As someone who had 2 premature kids myself, I know that there is no magic wand. There is no silver bullet, and MMS alone won't solve it all. We have to make healthcare and health systems work for women. We need to make sure that women receive at least the minimum number of A&C visits in pregnancy. We need to make sure that MMS is included as part of those visits. Ultimately, we need to make sure women have everywhere have access to all that they need to live healthy and fulfilling lives. Clearly, the problem is complex and the needs are significant, but we can't let the breadth of the problem stop us from taking an important step forward. Again, as someone who has gone through my own experience of having kids far too soon and far too small, I'll tell you that even if MMS can't solve it all, the fact that it can do a whole lot to avoid other women and parents and their kids from experiences like my own means it's time to urgently act. So what will that take? I think the first thing is that we need consensus among at least the group here today that we can bring MMS to scale over the next 5 years. Like all of you, I am well aware of the many constraints that stand in the way of us achieving that goal. But I also know that unless we allow ourselves to think big, we'll continue to see at best small and incremental improvements in maternal health and malnutrition. I would argue that the history of global health overall is one where we've seen stakeholders set really radical goals and then demand that stakeholders and systems flex to meet them. We all cite amazing progress in reducing mortality, expanding access to immunization, eradicating diseases over the last 40 or 50 years of public health. And each and every one of these points of progress took this type of ambitious vision. We need to do just the same on MMS. I've been an advocate for malnutrition myself for many years now, and I find that we're often quite good at pointing out all the constraints on financing and politics and systems and programs that will stand in the way of achieving big goals. And I think it's good that we're clear-eyed about the challenges that will stand in the way. But I think all too often, it makes it hard for us to agree to think big at all, unless we allow ourselves to think big and act big despite the challenges. I am pretty confident that we'll be back here in 5 years having a webinar talking about the need to urgently scale MMS. So we need to think big, and then we need to act big. And I've taken a look at some of the participants here today, and I know that there are many out there who are already relentlessly pursuing ambitious impact. And I've had the pleasure and honor of working with a number of you who have spent years and decades driving for that impact. You all have paved the way, but it's up to the rest of us to join them in those efforts and push for a global movement to bring MMS to scale. At ECF, this is an active agenda for us. We're working on proposals that we can put in front of major bilateral donors, partner philanthropies, and country governments this year. And we want to see others commit action, leadership, and financing to drive towards this goal. But pledging to join in is one thing. What we really need from every stakeholder, including those here today, is a consideration of what you can do in your role to push past those boundaries and to accelerate change. I hope anyone out there with ideas about how we can push ahead boldly together will reach out to us at ECF so we can support your efforts. I'll reiterate what we heard at the beginning of the session today. MMS and the Power 4 are just the start, but we need to start somewhere. Today, there are millions of pregnant women who are fearing and not celebrating the outcomes of their pregnancies. We have tools to change that. Those women should not have to wait for that magic wand. They should benefit from the evidence. Really, again, appreciate being here today and look forward for further discussion with the group. Thanks.
Thank you, Kim. And that was really powerful. Not just think big, but act big, and using your personal experience and actually translating that into this impatience and say, okay, we just can't, it's unacceptable that there are still millions of women out there that have to fear the outcome of pregnancy. We're with you all the way. And I hope many of us on the call, on the webinar are. A wonderful call to action here. I would like to go to the next speaker now, who will also speak, I hope, from her experience at country level. I'm very pleased to present to you Luz Tagunikar. She is the Supervising Health Program Officer of the Disease Prevention and Control Bureau of the Department of Health in the Philippines. And Luz will talk about the experience in the Philippines. What are the opportunities, the challenges, and the lessons for addressing micronutrient deficiencies, specifically anemia in women in the Philippines? Luz, the mic is yours.
Good evening.
Great, go ahead.
Okay, good evening, everyone. Thank you for the organizer for inviting us from the Philippines to share our experience in the implementation of micronutrient supplementation program. The Department of Health has started micronutrient supplementation program as early as 1993. However, because it never gained the attention and even the priority that it truly deserved, the implementation is really not that wide scale. And our commitment for the achievement of the Millennium Development Goal really opened the opportunity for us to scale up our implementation for micronutrient supplementation program. This, together with the release of the Lancet series on maternal and child health nutrition in 2013, plus the sin tax law that we have passed, there's an influx of additional funds that flows into the Department of Health, and that help the micronutrient supplementation program improve the investments in our program. Our legislative body also recognized the importance of the first 1,000 days as discussed by the Lancet series in 2013, and recognizing that in 2019, our legislators passed the Mother and Child Health and Nutrition Act in the Philippines. And this mandated the Department of Health to lead the implementation of the critical nutrition interventions. Of course, micronutrient supplementation is one of them during the first 1,000 days. This is done in collaboration with the National Nutrition Council of the Philippines and other agencies that work on education, agriculture, and social welfare. The same law also mandated the local government units to lead the planning as well as the investment of local nutrition program. During that time also, development partners like the UNICEF, World Health Organization, and non-government organizations like the World Vision, Vitamin Angels, Plan International also expressed support to the initiative. The multi-sectoral collaboration was further translated into the Philippine Plan of Action for Nutrition 2017 to 2022, and now its succession plan for 2023 to 2028. The PPAN, or the Philippine Plan of Action for Nutrition, generated specific and nutrition-sensitive interventions, investments on that, including micronutrient supplementation. This year, the Department of Health has launched the 4-year Philippine Multi-Sectoral Nutrition Project, funded by the World Bank, aimed to improve the nutritional status of women and children in priority 235 municipalities of the country, with micronutrient supplementation as one of the components of the project. When it comes to challenges, like most programs, there are a lot of challenges and hurdles in the implementation of micronutrient supplementation program. And the first challenge would be cost. We know the volume of the micronutrients required by a single target beneficiary, like for iron and folic acid, we need 180 tablets. And if we have 3 million mothers or pregnant women that need to consume and be provided with that commodity, then it would mean a lot of money from to the government. And so we advocated for the local government units to do also, or to provide their counterpart funds. However, not all of them has the capacity really to provide counterpart funds and really provide mobilization money for the delivery of these micronutrient supplements. The second challenge would be the equity. It should be available to all target groups, especially the poor and the marginalized. However, the Philippines has indigenous groups as well as hard-to-reach areas. We are an island country with 7,100 islands, and you know the difficulty of reaching those in the far-flung areas. And it would require anak, naputol ako.
We can hear you, Luz. It's fine.
Okay, sorry. I'm sorry, I thought I had that technical difficulty. Well, it needs a special mechanism for service delivery that burdens our limited health human resource, and of course, the low mobilization funds at the local government level. The third challenge would be the acceptability. Not all micronutrient supplements are acceptable to target beneficiaries, like the iron and folic acid, which mothers complain that it has some residual or bad taste. There is also poor adherence to prescribed dosage and duration of micronutrient supplements, and health and nutrition service providers have limited capacity to track its consumption. And the last and one of the biggest challenge also is the supply chain. Most of the micronutrient supplements are procured centrally by the Department of Health, and they are delivered to the local government units through our regional centers for health development. Since most of the micronutrients are sourced outside of the country, the long procurement process and inefficiencies in the delivery system result to stockouts of micronutrient supplements at the local government unit level. So it really is a challenge to have a sustainable as well as steady supply of micronutrients throughout the country all the time. When we go to the lessons learned, the Philippines was selected as one of the global exemplar for anemia reduction among women of reproductive age based on the study conducted by Sick Kids Center for Global Health, which affirmed that the country has indeed reduced the anemia prevalence from 27% in 2008 to 12% in 2018. Among those that were found by the study are some of the lessons that we have to look into, like that micronutrient supplementation should not be implemented in silo, because the study pointed out that micronutrient supplementation, along with quality antenatal care, family planning services, and other reproductive health services, contributed to anemia reduction. Improvement in healthcare utilization, like prenatal immunization, also increases access to micronutrient supplementation. LGU's leadership is key to program implementation, and they provide leadership, including counterpart funding, if they were made aware on the cost-benefit ratio of investing in micronutrient supplementation. Effective program design and implementation with targeted delivery system policies in place and coordination mechanism across sectors to improve financing, regulation, procurement, and capacity building is key to successful implementation of the micronutrient supplementation program. We know that our program in the Philippines is not implemented at its optimum. There are a lot of challenges, but we are doing something and we are gaining some success when it comes to reducing our micronutrient deficiencies. For vitamin A, iron, we are continually having a downward trend when it comes to the prevalence of these micronutrient deficiencies. And even though the Philippines is a low and middle income country, we know we're doing something. It's not perfect. It's not the optimal thing that a country should do in terms of financing, but we are doing something. Thank you.
Thank you so much, Luz. And I do believe you're doing something, but I also believe that the real concerns or the challenges that you're facing need to be addressed. And we need to kind of collate some lessons learned also from other places and see, well, what can be done. They're not easy challenges to overcome, that's for certain. I would like to go to the next speaker now, so that we finish in time and do have enough space for question and answers. And the next speaker is Frances Sotor. Frances is the Vice President of the International Union of Nutritional Sciences, but is also a professor at the University of Health and Allied Sciences in Ghana. And Frances, we have asked you to speak about what do you see as national priorities to accelerate nutrition progress, especially linked to the need of data. Over to you.
Thank you very much, Maddie. It's an honor and a pleasure, privilege actually, to be able to speak to all the participants who are here and others about the nutrition investment priorities for accelerating nutrition progress in Ghana. It is important to note, and I do want to bring your attention to Ghana as a low middle income country. The WFP World Health Program reports that over 5 million Ghanaians are food insecure, and an additional 2 million are vulnerable to food insecurity. However, the current state of food and nutrition in Ghana, according to the 2022 Global Nutrition Report, reveals both progress and challenges. It is worth noting that the government of Ghana understands the nutritional well-being of its populace and is understanding that fact that the bedrock of the national health and development has been necessitated for increased investment to accelerate nutrition progress and challenges in recent times, and they've done that. We also know that appropriate nutrition interventions targeting at infants, mothers of the future generation, are known pathways to health and development in the future. And hence, substantial progress in nutrition in Ghana has prioritized to accelerate nutrition progress, and that points to the first-hand evidence-based nutrition-specific interventions that, among others, target women in their reproductive age, maternal and nutrition and child health, including malnourished children. I am proud to say that the National Development Planning Commission is spearheading an investment plan, and they have come out with a newly developed policy prioritization model to look at the food system transformation and nutrition security using the cross-sectorial policy group. However, we need to also look at what are the nutrition policies, programs, and data and priority areas in Ghana currently. I can tell you that in the area of preconception, which is a priority area for Ghana, the folic acid supplementation for adolescent girls is actually mooted. And this has the support of the president's wife leading in this. Now, the program has been extended to all the regions in Ghana as a national program. Now, however, there is a gap. The iron folic acid tablets are not in constant supply nationally. And it's my hope that there will be a constant supply for the intake of iron folic acid to improve the macronutrient levels. And I'm sure Gosden et al. Has written a lot more about this. Now, it's very important to also know that there's a conception to delivery attempt looking at the maternal iron folic acid supplementation. But even though the antenatal coverage rates have exceeded 91% in Ghana in all regions by residents and wealth, the iron folic acid supplementation, as I said, is not in constant supply. And so there are hopes that this can improve. And I'm sure that our own colleague and John Hodinot has touched on this in his document. Now, if we look at the 6 to the 24 months, it also emphasizes the need for MNS. Micronutrient supplementation is very key. And one of our authors, Chiri Atta, has reported about 2.5 million micronutrient sachets have been distributed to nearly 30,000 children within 90 district miles. However, there's inconsistent supply of this, despite the high acceptance among citizens. What the data tells us that there is a need for scale-up. And the need for scale-up means that funding is very, very important in this case. Now, when we look at children between the ages of 0 to 59 months, vitamin A supplementation, child growth monitoring and promotion, and nutrition counseling are priority areas. And I can tell you that 79% of mothers have been reported as receiving 1 dose in the last year, while the health charts have shown 63.5%. There is, however, poor knowledge of the medical effect of vitamin A supplement deficiency, and also to look at the natural sources for this. Efforts are being made to address the malnourished children up to the age of 59. It's also important to note that the F75 and the F100 are things that are being used. Now, what are the policies and programs that are targeting preconception among adolescent girls and women? The initiatives, as I mentioned earlier, about the iron folic acid supplementation for adolescent girls is very important. Add to that is the nutrition education, including nutrition-friendly school initiatives and the school feeding program. And I'm pleased to say that these are being done in earnest to try to address our problems. Now, we also look at policies of targeting women at conception and delivery, child delivery. And apart from the maternal iron folic supplementation, we are also looking at areas of maternal nutrition education and looking at nutritional status, assessment status, as well as counseling. These are very important attempts to try and address our problems. Now, I'm pleased to say that much as we talked about the challenges, the progress that is being made and being led by the National Development Planning Commission is laudable. And I want to extend this on this platform to say that it will cost just $5 billion a year to address the malnutrition challenges across Africa. 5 billion. When we spend about 3-4 times of that just for advertisement alone. And so I'm calling you all that let us try to work collectively to address the malnutrition situation and the use of micro MMS is the way to go to address all these problems. Thank you very much.
Thank you very much, Francis, for this call to support, for mentioning these different interventions, and also specifically referring to adolescent girls. I thought it was very helpful. I would like to go now to the one before last speaker, which is my dear colleague, Martin Wangi. And I know that Martin, who is the program lead on Healthy Mothers, Healthy Babies, will talk about the power of partnerships. Martin, the floor is yours.
Thank you very much, Marty. And I'm really honored to share this platform with such eminent speakers. And because time has really moved, I will just dive into speaking about the power of partnerships. And this panel in itself and the over 200 people who are joining this call is actually an example of what partnerships can do. The nature of nutrition is that it has so many different sectors that contribute to it. And I think what is beautiful today is to see how our colleagues from the economics world are able actually to get us more focused by telling us what to prioritize. Universities around the world and research institutes and governments are all trying to do research, but also to do programmatic work to find out what works. And so periodically, it's very important when we get to this stage when we are told, if you have $1 and you want $37 in return, you might want to think about MMS. So these partnerships that we can now discuss from this point going on will align on a number of levels. Number one is resource mobilization. Any government stakeholder that you talk to, any implementer that you talk to, they will tell you that we will need resources. Now, partnerships would bring together various stakeholders, including governments, international organizations, civil society, and even private sector, to pool resources and their expertise, mobilize funds, such as what we heard from our colleague from ECF, and see how we can support the scaling up of interventions that are valuable for their area or their context where they operate from. This could include the production of MMS, could include procurement of MMS, could span out to even the distribution of MMS, because we know we come from different countries. Some are small, some are huge, and some have mountains, some have lakes. And therefore, how are you going to reach the very marginalized, the very people who need these interventions most? At the same time, we have to remember that the WHO guidelines talk of context specific. The guideline on MMS is currently in the context of rigorous research. And what that means is that every country has to look internally and see what is our context in relation to nutrient deficiencies, in relation to what kind of malnutrition situation do we have? What are we dealing with? To get the correct answer, they will have to leverage all the partners in their country, spanning from academia, who can help them with understanding the local situation through research, implementation research, but also looking at organizations that have been at the forefront of helping them implement programs, and then getting to understand, okay, then this might mean that we need MMS. Where can we get it? How can we fundraise for it? How can we scale it up at our level? I mean, this is where knowledge sharing and experience sharing comes in. So partnerships provide the platforms for knowledge exchange, and because every organization has what they would siphon and call best practices, which allows countries to learn from each other, organizations to learn from each other, the successes, but also the challenges that they have faced previously, for instance, with the implementation of iron and folic acid supplementation. We have constantly been told about the low coverage, the low adherence and compliance issues that got to do with iron and folic acid, which have also ended up having high rates of anemia and iron deficiency around the world. We have to make sure that even as we adopt MMS, we understand our contexts very well so that we don't repeat the mistake or the challenges that we faced with IFA. So this sharing of knowledge amongst partners helps in designing effective strategies and adapting interventions to local contexts so that we can be able to leapfrog and not repeat the errors of the past. Now, the other point is on the technical assistance that is needed and the capacity building that will be needed as we go on into rolling out MMS. We know that there are organizations that have a lot of technical expertise in these areas of public health and nutrition interventions, and we will have to leverage them to see how they can help organizations that are just starting or countries that are even considering capacity building, but how can they go around it? So if we are able to speak with one voice, if we are able to understand that good things don't come easy, and understand that especially the early adopters will have to overcome certain challenges which look huge if you're trying to walk alone. But if you hold hands with others, you will find that it's somebody else who has already figured out how to manufacture and supply. Somebody else might have the funds that could be used for this. Somebody else will have the training materials that you need. And therefore, going forward, what we are seeing is that when countries come together, they are able to decode the challenges that are ahead. We have seen an example, as I close, of 9 Asian countries that met in Jakarta last year and tried to talk about the challenges that they are facing when it comes to MMS implementation. Since then, we have seen Indonesia, for example, and Bangladesh. They have made major strides towards policy changes, but also supply of MMS at national level. And now we are confident that those countries are going to be able to scale up. If you think of the number of women they are going to be able to help with these life-saving interventions, then you can see why it is necessary to build partnerships. Over to you, Marty.
Thank you, Martin. And the partnerships, the building of the partnerships, I think that the Healthy Mothers, Healthy Babies Consortium is that platform for partners, specifically around maternal nutrition and even more in particular around MMS. So, and I actually see in the long list of attendees, several of the people that attended that particular meeting you refer to. Before I go to the last speaker, and then we have half an hour of Q&As, I would like to call upon all these over 200 people that are attending to please continue writing your questions in the Q&A. I can see that there were a number of questions that have been answered, but we would love to get more questions and address them as we go. And then now I'm very happy to go to the last speaker, Alok Ranjan, who is the Director of Programs of the Power of Nutrition. And I believe, Alok, that you will build forward on that theme of powerful partnerships, but then talking about innovative financing partnerships. Please go ahead, Alok.
Thank you, Marty. And thanks for inviting Power of Nutrition for this important webinar discussion. And I think having us at the last really is useful from the Power of Nutrition's perspective in this discussion, because right from what we heard from John's video to what we heard Martin share from the Healthy Mothers partnership focus approach. If you look at all of that, I think the Power of Nutrition is one is very proud to say that these are all the aspects that we really breathe in day in and day out in our engagement with various funders and implementing partners and the government where we work with. In the next few minutes, I'll be talking about two aspects: our model, which was focus a bit on the innovative financing question that you posed, and the second would be in terms of giving an example around how in one country we are trying to do something similar around the National Micronutrient and MMS program. So to start with our model, it is an innovative financing model that was created in 2015 with then FCDO, then DFID, CIF, and UBS Optimus Foundation coming together. And we had two main aim, right? One was to have increased money for nutrition, which was raising more money through the public-private partnership co-financing mechanism. And second was to create partnerships, investments, where we are working with world-class partners, implementing partners, including World Bank, UNICEF, and a host of INGO partners that we are engaging and partnering with around this. So what this innovative financing mechanism has enabled us to do is like across 16 countries through our 22 programs, we are reaching 133 million women, children, and adolescents. And out of these, around 30 million were pregnant lactating women that we were reaching across these countries. So our model, innovative financing model, traditionally had been where we used to generate, say, $1 from the private sector funding, and with the platform funding, we match that $1, it becomes $2. And then with the set of implementing partners that we co-create partnerships and programs, they bring equal matching amount. So it kind of becomes a 4 times multiplier for every new dollar that we bring into the programming. So this leads to a kind of a co-creation across these funders, multiple funders being brought together, multiple implementing partners being brought together, and making a program, co-creating a program with them. And that brings me to the second part of what I wanted to share was about the program. So all our interventions since 2015, when we started, had been focused on the Lancet 11 interventions that were prioritized. And as we go ahead, more and more multi-sectoral partnerships is what we are trying to create and work on. Out of the 22 programs, 20 programs have very strong focus on vitamin A and iron folic acid components. So improving access to antenatal care and focusing on micronutrient supplements for pregnant women is key component of majority of our investments. But in this, iron folic acid is still the micronutrient that has been the key priority, but with now the evidence that's available around MMS, with the kind of a focus that Copenhagen Consensus and others are bringing in, we hope that we'll be having more and more partnerships created across funders, implementing partners, and government, which will be focusing on MMS and this transition from IFA to MMS. And one such example that we have is the program that we started recently in Zambia. So that's a program where instead of one funder supporting a program in a country on transition from IFA to MMS, whether on the evidence or in the policy or the implementation, we tried to make it something where we bring in the costing and the risk shared across the different stakeholders, and not just work on only evidence or policy or the implementation, but work across this continuum of evidence to policy to action, so that it doesn't remain in a siloed state in that continuum as we go ahead. So in Zambia, the program that we are having, this is where we get also first time in our across our 22 programs way of gift in kind being a part of our programming. So it was new for us also to co-create that kind of partnership. So we with support from our partner Kirk Humanitarian, we had the gift in kind resources. Then with our platform funding, we had the matching of that resources. And then with the implementing partner, and we have World Vision as a strong and we're proud to have World Vision as a implementing partner in Zambia for this program. So with these, we also have this whole research component as a big aspect in Zambia, where we have Zambian Tropical Disease Research Center supported with Vitamin Angels on the research component very strongly. So looking at the whole in-country resource development as well from the research and long-term sustainability aspect of this. So what does this project do? It is going to focus on providing MMS over the next 24 months across 300,000 pregnant women in 3 targeted provinces in Zambia. The Ministry of Health, with complete buy-in from their side, they are looking at this as a pilot project whose research will help inform a decision that the Zambian government will take at the end of this phase on whether to add MMS to the essential drug list and this whole switching from IFA to MMS. So the key research aspects that we are having in this is cost benefit analysis, a supply readiness assessment, and budget impact analysis as well at the same point of time, because these are the things that the government would need as they go ahead. And across the Ministry of Health, very strong coordination across their child health and nutrition team, reproductive health, and the pharmacy component. Just going back to the aspect that Liz was mentioning, that it's not just only the supply side or the supply chain strengthening, it's also that we are working along with that on the demand side aspects and ensuring women are well informed about this. So thanks to all the partners, Government of Zambia, the Ministry of Health, Kirk Humanitarian, our platform funders, World Vision, Vitamin Angels, and Tropical Disease Research Center. I think we are very proud of what we have started. And just adding on from that, we are looking at almost 3 to 4 investments every year. And in that process, the Copenhagen Consensus document, our experience of working across multiple partners and micronutrient being a key component on that. And the way there are opportunities coming out, like, for example, Child Nutrition Fund, which is providing opportunities for government to add their domestic resource so that it could unlock more resources for things like multiple micronutrient supplements or SQLNS, the way Mira was mentioning about that. So this would be kind of really useful for us as we go ahead. And I just wanted to highlight that this whole continuum from evidence to policy to action, if we look at it as that entire continuum and not just creating evidence or creating policy or just implementing, I think that will be the way forward for us on this going ahead partnership. Thank you.
Alok, this is wonderful. Thank you so much. I do believe you and Martin need to catch up. I do believe that the evidence, what you said, this whole evidence to policy to implementation continuum is something that at Healthy Mothers, Healthy Babies is being discussed as well. So that's the Zambia experience sounds very good to me. Thank you for this. We have come to the end of the presentations, and now I really, before we go to some questions to the various speakers, I just, one reflection. What I'm hearing from all the speakers is that, we're talking micronutrients, they're not so micro, they're only micro in amounts, but these vitamins and minerals are in fact pretty mighty, right? And as we hear, they have huge impact, there's strong scientific evidence, and as the Copenhagen Consensus data tell us, they are one of the best bets of overall development. And of course, we know that there's now, there's these new estimates of micronutrient deficiencies. Last year, the Lancet Global Health paper really raised alarms on how hidden hunger still continues to undermine our economies and our societies. And that is specifically concerning with the crisis that we have envisaged, like the pandemic and etc. Because those crises have not only weakened health and food systems and economies, but they have also weakened the resilience of vulnerable individuals and communities to cope and to recover from these shocks. So we really need to invest in I would say, strengthening that resilience. And this incredible set of excellent and eminent speakers, I believe, have given us a lot of reasons to be optimistic. Their collective message does point to the power of stakeholders coming together, supporting decision makers with clear science, with economic evidence, and then followed by a clear policy asks. And as Luz was hinting, really needing support to to overcome the challenges in implementation. But I'm pretty hopeful that we are now starting to see this new era of collaboration and progress in driving and accelerating the agenda, so that we do not have to wait another 15 years and we're not at the same point when we're discussing in even 5 years. Just 1 week ago, actually, there was the International Maternal Newborn Health Conference, in Cape Town, and WHO and UNICEF launched the Anemia Action Alliance there. That is a new initiative, multi-sectoral initiative, that wants to focus on accelerating actions to reduce anemia in women, adolescent girls, and children. Anemia being one of the targets of SDG 2, but not having moved a lot. So that is one of the initiatives coming together, partnerships to really move the agenda. I would like to now ask all the speakers to turn on their camera, because I would like to go to some back and forth, some questions with them. And I will also then check the Q&A to see if there's any of your questions that might be put to them. Everybody, I think I would like to start with Loes and Maarten. I'm asking the same question to both of you, but I'm sure you have your different perspectives. So we have heard, and there's been a call, Pim was very strong actually, there is a call for action. We must accelerate, we must scale up actions. And actually national leaders are driving this agenda. Of course they need support, but they are in the driver's seat. Now, Loes, first with you, what gives you hope that action on micronutrient interventions are actually being scaled up at the national level? But also, what, according to you, would need further strengthening to get there? So that's those questions, the upside, the positive one, and the downside on getting to scale. And Maarten, then I will come to you. Loes, over to you.
Okay, thank you for that question. I think we have hope and we have high hopes that the government would really support us in scaling up the implementation of micronutrient supplementation program, nutrition being put as one of the priority of the Department of Health. And we have a good support from our development partners, as well as our legislators. And the government is also sharing some of the tax collections from the sin tax, from tobacco, and also for the sweetened beverages. And they flow it to the Department of Health to finance our priority programs, one of which is the micronutrient supplementation program and other nutrition interventions. That is our hope, that we can scale up investments as well as procurement of the essential nutrition commodities. But the challenges would still be how the local government units would really deliver the services, or make the beneficiaries really access these commodities and use it to the maximum. Because the Philippines has a devolved setup, meaning the National Department of Health has no direct link to the local government units, or meaning we are the source of technical assistance, but administratively they are not under us, and we cannot force them to do something which they think is not their priority. So even if we have all those commodities, the capability building, as well as the policies that we have crafted at the national level, if the local government unit will not have their buy-in and really implement the micronutrient supplementation program and translate it really by bringing these commodities to the real beneficiaries, the mothers, the children, then that is the biggest challenge that we have in the country.
Thank you. Yeah, I do understand decentralized service delivery and the decision making is really important. And I actually have seen a lot of good things happening in the Philippines on that, but how to get the capacity there, etc. Maarten, over to you. I'm wondering if lessons can be learned elsewhere or partnerships can be a help here.
You know, yeah, You know, we have good reason to be hopeful and about the fact that increasing action on micronutrient interventions at national level is going to kind of scale up. There is increasing recognition that everything starts with a healthy mother. A few years ago, everything was focused on only making sure that we have very healthy under fives. But in the recent past, we have seen an increasing or a scale up of focus on healthy women who are going to end up getting as healthy babies, who are going to end up being very active contributors to society, economically speaking. And that is only when John Hodino's mathematics then makes sense, because then these people contribute to the economics of the country. So this increasing research and evidence, both on the efficacy, but also on the economic side, that is one thing that is giving a lot of hope, because policymakers like to hear about what is going to happen to the economy. The second thing is about the increased funding. I think we have heard from the executive director of the ECF, Elena Crook Foundation, that funders are aligning to make funding available for nutrition so that countries can be able to invest and scale up these life-saving interventions. And therefore, that is always a big worry. If that can actually happen, I think we are going to be on better footing. At the same time, we have seen national policies becoming positive towards life-saving interventions like MMS, and we are also seeing now global partnerships and alignments happening. So just to say that, for instance, this year, we are going to have a meeting in Addis Ababa, the African Union headquarters, where 12 African countries are gathering in July to specifically discuss maternal nutrition and MMS in particular, to see how can they unlock the barriers that they are experiencing at their national level. What can they learn from other countries that have already done some pilot work? They are going to share knowledge. They are going to exchange best practices. They are going to see what are the cross-border knowledge that could help unlock some of the issues that are being seen in other countries. So yes, I would say that there is going to be momentum. We have hope. And I think what remains now is to be able to, all of us, work to our ministries of finance and make this business case for maternal nutrition interventions, and specifically MMS, and get the funding that we need to improve our healthcare systems. Over to you, Marty.
Yeah, thank you, Martin. And before we go to the Ministries of Health, I want to go to the Ministries of Finance. I wanted to go to the Ministries of Health, and I'm going to ask each speaker to be a little bit shorter in their answers so that we make it in time. John, and I will come to you first, and then Francis. A brief, crisp answer, because both of you are scientists, you're looking at data. National decision makers make their decisions, at least in part, on existing evidence. Now, what is the one main question that you believe that decision makers in the Ministries of Health still need to be answered? Because we know already about the efficacy of many interventions, we know about the cost effectiveness. So is there one other remaining question that you believe Ministries of Health may need to see so that they make a positive decision to integrate these micronutrient interventions in the overall universal health coverage? John, first to you.
Yeah, Marty, I think, as you say, we're now in a place where the science is very solid and the economics is very solid, particularly around MMS. I think the remaining question would arise, in fact, both in Ministries of Health and in Ministries of Finance, is to say, is this truly implementable? People come to these ministries all the time with ideas. A lot of the ideas might be good, they might not be so good, but sometimes they're just hopelessly impractical. I don't think that's the case for MMS. I think the roadmaps that Martin and Luz provided to us in their earlier questions are good ways forward of national consultations, of identifying very specific barriers. I think if we can assure decision makers that in fact it is possible to implement MMS supplementation at wide scale, that would remove, I think, the last of the barriers we currently have to its widespread scale up.
Thank you very much, John. Francis, what is your thought? a brief, crisp answer, please. What other question to the Minister of Health?
Well, it's very important to get academia to come down from their glass houses and begin to work together to address the challenges and present a strong evidence. When that strong evidence is presented, I am very positive that the government will prioritize areas to address the malnutrition challenges that confront us. And they would allocate the little funding that they have to address the multiple micronutrient supplementation. So it's down to academia working together to address these problems. And I believe that positive deviance, when we can learn from each other in country and across countries, will bring the solutions much faster than we anticipate. Thank you.
Thank you, Francis. I also think that when we're talking about evidence, we do talk also about the implementation science. So when John talks about the feasibility of the implementation, we have to move from some of the efficacy studies really also to, I think, implementation science. I'm now going to Kim and Alok, and I would first, Alok, I have a question for you. Since you were talking about the Zambia example, and we are talking about partnerships and going from, evidence policy implementation. What are the elements that make such a, let's say, a partnership or such a continuum actually very powerful? Who need to be at the table for that? And what is new there?
I think apart from who needs to be there at the table, people need to be there.
Who are the new people that need to be at the table? Maybe that's the better question.
Yeah, so it needs folks who are interested in all three aspects. Folks who are interested in the evidence aspect, folks who are interested in the policy aspect, and the folks who are interested in the implementation aspect. And I think very important that they need to be at the table without any egos or logos with them. Many a times that becomes a hindrance aspect in kind of moving ahead. But I'll just highlight some of the things that's there in terms of for the ministry to move ahead with what we are trying to do here. There are these policy briefs like the one we shared on Zambia that Nutrition International had done. And they have done it for 32 countries, which is available at this point of time, at least. So countries have that thing. There is this whole World Bank Optima tool that Mira talked about, which talks about allocative efficiencies and all. So it's ministry, but even in ministry, it's not the Ministry of Health. It's Ministry of Health, Ministry of Finance, their data, the planning wing. Everyone has to be there as a part of it. Then there is this whole thing, people asking about what is the impact that has been done with different intervention. And that's where things like the list model and which gives you the impact of the various interventions comes into play. So there are so many things which is already existing and doesn't need to be reinvented for us to get the impact. But last but not the least, Marty, the thing that has really worked in the health sector, looking at the health system strengthening approach, the 6 pillars, I think we have to approach anything in nutrition from that lens as well. Are we looking at all the pillars and addressing all, or are we just working on one aspect? Because otherwise it will have the same bottlenecks that Francis and others were talking about, or Luz was talking about, in terms of focus a lot on the supply, but not really looking at what is it that needs to be done on the demand side, what is it that needs to be done on the governance side, what is it needs to be done on the capacity building side, or other components that we're talking, and the financing. So it's something I would say we need to start looking at folks who really knows the system strengthening approach. Can they help this thing to be solved?
Thank you very much. I like that, the system strengthening part. And we all know that. I mean, one of the reasons IFA may not have been the success that it could have been is probably more of the weak implementation than really the efficacy of the product itself. Kim, if I ask you, maybe the very simple question that I want to ask you is, what will you tell the Ministry of Finance of country X when you meet that country? What would you say to lift up micronutrient interventions, specifically maybe MMS, in that crowded and shrinking budget of these ministries?
Yeah, I mean, I think first it's probably not possible to overemphasize how constrained budgets are right now with all of the needs in the world. So this is a very real dynamic. With that said, I think that there are some sort of tried and true principles that we can apply in doing advocacy and engaging with policymakers and country governments and donor agencies. The first, I think, is to not be shy about the extent of the problem. We've talked a lot about the extent of the problem here. I think in a world of a lot of problems, it can be easy to want to emphasize everything that's wrong. It's okay for us to say, this is also wrong. It requires urgent action. I think the second thing is really providing those actionable solutions that do exist. If your friend comes to you and says, my life is in shambles and here are the 100 things that are wrong, and then just stares at you, you're probably going to feel pretty helpless and hopeless about what you can do to help. But if your friend comes to you and says, my life is in shambles, here's all that's wrong, and can you drive me to the doctor tomorrow? Can you pick up some groceries for me? You probably won't think twice about jumping in to help. I think a very similar dynamic applies when we're talking to policymakers, and we need to keep that in mind. I think the third thing is that cost effectiveness always matters to policymakers. It especially matters in times of austere budgets. So, we've heard a lot of the data today. We have lots of great resources that we can use at our disposal. And so we really need to be emphasizing those points. I just end by saying there is still a lot of reason for hope, despite the challenges and despite the fact that budgets are constrained and in some cases shrinking. We've seen some really effective advocacy in the malnutrition space over the last 5 years, thanks to a lot of advocates who are on this call. And I think all of those successful advocacy moments and pushes have had some element of those principles. So we should really learn from that and keep those in mind as we move forward.
Thank you, Kim. I see a lot of questions at this moment coming up in the Q&A, and I'm going through them, but I ask you also as speakers to go and check. If we don't get to answering them, we'll collect them and try to make the answers to these questions available through the website of the HMHP or something like that. Mira, I'm going to you. You'll get the last question that I ask, and I also will then ask you to kind of give your closing remarks. I actually had wanted to ask you how you're going to talk to your new president of the World Bank when he starts on the 1st of June, and what will you say to lift up micronutrient interventions? But I think that would be too well. I still hope that you'll make a remark about that. But I also see in the chat a lot of questions from people, well, how do we actually uplift or deliver MMS in security challenge settings, in humanitarian settings, in conflict situations? How do we do that? And I don't know if that's a right question for you, but I thought, does World Bank support nutrition in conflict areas, or what would you recommend? Over to you. And you may continue and round off with some closing remarks, after which I only need 1 minute.
All right, thank you. I'll try and be brief. So you have lots of questions out there. First and foremost, talking to the new World Bank president, it's always a privilege to do that. And this will be my 6th president in my term at the bank. I have to say that when we speak to the president of the World Bank, I'm going to disappoint all of you. We will not talk about micronutrients. We will not talk about MMS. That's just not the right pitch for somebody at that level. We will talk about how important nutrition is for human capital, for driving economic productivity, reducing poverty, all the SDG goals wrapped into and how nutrition links to that. So that will be the pitch, very different from the conversation we've been having over here. But having said that, as all of you know, the bank invests in a wide range of sectors, from building roads to building bridges to, of course, education, health, climate change, which will be a big agenda for the new president. Given all of that, what we will need to do is to make the link between nutrition and climate, nutrition and productivity. That's the pitch that we need to make. That's been my lesson learned from the previous presidents. And having said that, some of the evidence that John presented from the Copenhagen Consensus is extremely useful. We'll package it differently, but nonetheless use that as the basis for making the case. And ultimately, the decision lies with the countries themselves. Every country develops its own development plan, and the bank teams advocate based on evidence. So we'll use the evidence, help countries develop this thing. And then, of course, the president is often the best messenger for the country, senior leadership, the presidents and the prime ministers in countries. And that's where we will try and build this in. In terms of working in conflict areas, yes, the bank does support very much so in conflict areas. Again, the focus will be on the wider development agenda, and the challenge for all of us who work in the health and nutrition sectors is to build these into the wider development areas, into the universal health care package. Many countries do not even include nutrition in the UHC package. If it's not included, it's not financed. So it's not going to happen. So that's sort of the bigger picture focus that we would use from the World Bank side. So let me now, we're coming close to the end, so let me emphasize a few takeaways that I heard this morning. First, as all of you have said, we went through the food, fuel, finance crisis, then COVID hit on top of that, then the fertilizer crisis came, then of course the climate crisis has been ongoing, and now the conflict issues are still ongoing and impacting food security across the world. And our challenge is we're halfway to the SDGs, as many of you have mentioned. Yet progress, at least on the nutrition side, in fact, across the whole development agenda, is quite a bit less than what we had hoped for. And in some cases, like anemia, we've actually seen a backsliding on the progress, especially maternal anemia. So these are issues we really need to, I think Kim said that we've been too shy about talking about these things. We need to speak up quite clearly. Now, ensuring that we bring forward the best evidence possible, that's important, that's critical. And you've heard that from John, from all of the saying how important MMS is, SQLNS is, all of that. But I also want to remind ourselves that we don't want to forget some of the existing evidence. These are new pieces of evidence, but existing evidence on exclusive breastfeeding, for example. We don't want to drop the ball on that. Sometimes we get very excited with the shiny new thing, and we forget that we have. So from our side, we really want to focus on a package of high impact interventions and wrapped around the wider nutrition sensitive interventions like gender and of course climate, which is really important. We haven't talked about it very much, but absolutely critical. But even more important than all the evidence is going to scale, and every speaker has touched upon that issue. You can have the best evidence in the world, but it's not useful if it doesn't reach the people who need it. And that is really where we need to put all of our collective emphasis. As somebody said, iron folic acid, to date, even though we've known it's a good intervention, only 40% coverage. Salt iodization, we started in 1928. We still don't have 100% coverage. So let's not forget that scale, 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 absolutely critical. To achieve scale, we need 5 things that I can think of at the moment. First, of course, is we need national guidelines. Every country needs to have guidelines that help to scale up the interventions that we're talking about. Secondly, and again, has been discussed, adequate supplies of these new products. MMS, I think, is a great thing, but it's not available. SQLNS, similarly, is not available. We've had conversations with countries that want to scale up, but we don't have the supply chains are constrained. Third, and this again has been mentioned, you just can't push on the supply side, the demand side as well. Getting the message out, why women need MMS, why children will benefit from SQLNS, why the world will benefit from these interventions. That's critical, demand side. I'm forgetting if it's third or fourth is, fourth, it is strengthening delivery mechanisms. If we don't have a way to deliver these interventions consistently at scale to the people who need them, whether they are in the mountains, in the highlands, or in the forests or somewhere else, we really need to strengthen our delivery and their different delivery mechanisms will work for different different audiences or different groups. And lastly, and I'm going to end over there, is of course finance. If you don't have the resources, you will never be able to deliver at scale, and that is financing, domestic financing, donor financing, but also innovative financing. We've seen ODA for health has increased over the COVID thing, but most of it has gone to COVID interventions rather than these wider interventions. So lots more for all of us to do, but we will build on the evidence base that the Copenhagen Consensus has shared with us. And now, Marty, I know you want to talk about the 6th Global Conference. So over to you. Thank you all very, very much.
Thank you so much, Mira. And I will repeat the 5 points. National guidelines, we need adequate supply. And I know there are a couple of people on the call that are working very hard on that supply. Demand creation, strengthening delivery mechanisms, and there's many different ones. And I think the 1,000 islands in the Philippines require something. And I also saw comments by people about a market-based delivery mechanisms. And the 5th one, finance. What I specifically liked is what you said. I believe the message you're going to give your new president is exactly the message we all have to give to ministries of finance. This is not about this supplement or that supplement. This is about investment in human capital. This is about investment in productivity. This is about investment in the future of these countries and these societies. So with that, yes, I would like to thank everybody, the excellent speakers, all of you for giving your thoughts. And I specifically would like to thank all the participants for attending this fascinating webinar. I do believe that micronutrient interventions, and specifically maybe MMS and small quantity LNS, are one of the best bets in development, but we need to scale them up. The key point being on scaling it up so that we have an impact on productivity and human capital. And now I'd like to draw your attention to the upcoming Micronutrients Forum conference in October this year, 16th through 20th. It has the theme Nutrition for Resilience. And I believe this webinar is very to the point for that. At our conference, you can meet experts and colleagues from around the world and hear more about the evidence on efficacy, effectiveness, and the enabling policy environment for micronutrient interventions. It is a hybrid conference. All the program content will be accessible virtually, either live streamed, I think most of it is live streamed, or it's going to be uploaded within a couple of hours. Now, there is an in-person element, so everybody that would like to join us, please come to the Netherlands, which is a coincidence, happens to be my country of birth. Early bird registration is ending on the 30th of May. Of course, you can register after that, but I thought I'll let you know, you have 2 more weeks to register. We hope to see you there, either online or in person. And I want to thank you once more for all these people, over 100 people that are still with us 3 minutes over time. Thank you very much, and looking forward to see you at the next webinar of the Micronutrient Forum. Goodbye. Thank you, everybody, all the speakers. It was wonderful.
Thanks, Marty. Thanks, everyone.
Thanks, Marty.
Bye.
Thank you, Marty.
Thank you, Mira. Take a good rest after your trip.
Bye.
Bye-bye.
Bye-bye.